Let's talk a little bit about perineal massage in pregnancy. I have a model with me. This area here is the perineum, and perineal massage is an easy and helpful way to prepare the skin on the perineum and also the pelvic floor muscles underneath. The evidence suggests that perineal massage in pregnancy helps to reduce the likelihood of some of the more significant perineal tears, also helps to reduce the likelihood of needing an episiotomy, also helps to reduce the likelihood of ongoing pain in this area after you've had a baby, and reduces the second stage of delivery, which is the pushing stage. You can start perineal massage between 34 and 36 weeks of pregnancy and continue all the way through until baby is born. We normally suggest you do about 5 minutes each time and aiming to do it 2 or 3 times a week. It will feel like a strong stretch, but it should not cause any pain, bruising or bleeding. Please stop if you're having those symptoms. Perineal massage can be done by you or your partner, and there really is no one right way to do it. So before you start, wash your hands and find some water-based lubricant or a natural oil, but please try and avoid things like Vaseline, baby oil and bio oil. There is no right or wrong in terms of a technique. I tend to talk about 2 techniques. The first is a sweep technique. The sweep is where you insert a finger or a thumb into the vagina and you're sweeping in a U shape as far around as you can around this bottom half of the vagina. Now, if it's your thumb, you're going to pop it in and you're going to sweep around. But obviously to do the other side, you're going to need to swap and you're going to have to put your thumb in it and sweep. Now, if your partner's doing it for you, they obviously can have their fingers in here and they can sweep both sides at the same time for you. So the sweep is sweeping as far as you can. You repeat that 5 to 10 times and then you can do the same thing on the other side, sweeping round. So it's insert and then it's sweep. Now you can see I've got a bit of a stretch on. Remember, there needs to be stretch on here when you do your sweep. The other technique is more of a stretch and hold. So same thing, we're working in the lower half of the vagina, avoiding the top. So if you thought of a clock, it's a little bit like this is 12 o'clock, 3 o'clock, 6 o'clock, 9 o'clock. We're working between that 3 o'clock and 9 o'clock. So if you're going to do a stretch and hold, it's literally a stretch so that you get a stretch on the tissue and you hold. You can start for 10 seconds and then relax and release, working your way up to holding for longer, like up to a minute. Remember not to contract your pelvic floor during this. It needs to stay nice and relaxed and try and keep breathing. This is repeated 5 to 10 times, working all the way around the vaginal entrance, and should take you roughly 5 minutes. In terms of position, you need to find a position that's comfortable for you. If your partner's doing this for you, reclining on the bed is probably the easiest position. If you're doing it yourself, play with all the positions, lying on your side, reclining back. You can even try putting one foot up on the toilet and reaching. You might find that sitting and leaning forwards and reaching is also useful. There's no right or wrong. It's the easiest way for you to reach this area of your perineum in order to help stretch and prepare the skin and the pelvic floor muscles ready for delivery.